Hi, my amazing people. I trust everybody is doing well. All right. I want to say one welcome to my new followers. Please, you're highly welcome. My name is Chidima Okafor. Here I discuss everything about our health. You are free to talk to me. You are free to ask your question. You are free to make your recommendation. One thing I'm just asking is please share my videos just to create more awareness. You might be helping a lot of people. We are just talking about our health. All right. So I just want to quickly talk about cervical carcinoma, cervical cancer. This is one of the cancer that affects female reproductive organ, internal female reproductive organ. Yeah, this cancer is just found around your cervix. Any cancer that is found around the cervix is called cervical cancer. It's more prevalent among the women under the age of 45 years, but anyone that has cervix are at risk of having cervical cancer unless you've done what we call total hysterectomy, which is a surgical procedure that removes the cervix and womb together. Other than that, you can have cervical cancer. Okay, this cancer is treatable and it grows quite slowly. Let's talk about this cancer because it's very, very important. When it is detected early, the chances of survival is high. Okay, all right. What are the symptoms of cervical cancer? What are the typical symptoms of cervical cancer or cervical carcinoma? One is vaginal bleeding, either during or after sex, vaginal bleeding in between your periods, vaginal bleeding after menopause. You might have, changes in your vaginal discharge. You might have pain during sexual intercourse. You might also have lower abdominal pain or lower back pain. These are the typical symptoms you will experience if you have cervical cancer. Now, what causes this cervical cancer? It's caused by a virus called human papilloma virus, right? HPV virus. This virus can be contacted through skin to skin with your genital area, maybe during sexual intercourse. If you practice unsafe sex, anal, oral, and vaginal sex, can put you at risk of having this virus. If you also share your sex toys with people, it can put you at risk of having this virus. Risk factors to cervical cancer, people are at more risk. We say that it's more prevalent among women under the age of 45 years. Then, if you have multiple children and you gave birth quite early, maybe before 17 years old, you are at risk of having this virus. Then, if you have some immune system problem, you have weakened immune system, maybe you suffer from HIV virus or other disease condition that affect our immune system, you are at risk of having this virus. If you have other cancers like vulvar cancer, vaginal cancer, kidney cancer, bladder cancer, you are also at risk of having this cancer. How can we lower the chances of having cervical cancer? Yes, we know that we can not prevent it from, occurring, but we can lower the chances of having it. One way you can lower your chance of having this virus is by going for cervical screening test, especially if you are between the age of 25 to 64 years. You need to go for annual cervical screening test, or what we call pap smear. It's a very simple test where they will collect a sample of your cervical cells and screen it for human papilloma virus. Okay? Then, if you have the virus, you'll be treated. Then if you have the virus, you'll be treated. They will commence treatment quite early. Then children, girl child between the age of 11 and 12 are meant to get their HPV vaccine. So if your child is among this age group, you need to go for HPV vaccination. All right? It's very, very, very important. Then you also need to practice safe sex. Safe sex, wear condom for anal sex, for oral sex, and for vaginal sex. Stop being in contact with people's genital areas because you can get it from anybody. Okay, then you also need to quit smoking. We know smoking puts you at risk of most of these cancers. So if you are smoking, quit smoking. Then eat well. Healthy diet will help to boost your immune system, and that will give you a hedge over this. That will help you to fight against all this virus. Eat very, very well. All right, thank you for watching. Share this information is very important because cervical cancer is very prevalent, is very, very common these days. And the worst thing about this cancer is that it affects our internal organs. You can't just see it. It can be detected by screening. Thank you for your time. Bye bye bye.